As part of the federal government's ongoing efforts to cut spending, the National Institute of Occupational Safety and Health, also known as NIOSH, is laying off at least two-thirds of its staff under a restructuring order from Health and Human Services Secretary Robert F. Kennedy Jr. On Tuesday, more than 800 employees in NIOSH received layoff notices. That's out of more than 2,300 notices sent to the CDC. 10,000 workers are expected to be let go across the Department of Health and Human Services this year. NIOSH was created by Congress in 1970 as part of the Centers for Disease Control and Prevention. The organization says it focuses on empowering employers and workers to create safe and healthy workplaces. CBS News digital reporter Alex Tin joins us. Alex, tell us more about NIOSH and how the public could be impacted.
Yeah, that's right. NIOSH was created by Congress for the specific purpose of studying workplace safety. What that looks like in practice is everything from, N95 respirators, which a lot of people, I think, are familiar with now after the COVID-19 pandemic. Those N95 respirators are regulated by NIOSH. They go to a NIOSH lab to be tested. The mark on it is regulated by NIOSH. All the way over to, if you have a outbreak of a suspicious fungus at your workplace. That's something that happened recently in Michigan. It's NIOSH investigators that workplaces often invite to come in and actually try to figure out what's making their workers sick. They write those up, they do a study, and they publish that not just to help the workplace prevent more workers from getting sick, but obviously to prevent other workplaces from having similar kinds of issues. All of that work has now been affected as a result of these layoffs. Like you said at the beginning, we heard that more than 800 workers at this agency, which only numbers around a little more than 1,000, were sent layoff notices today as a result of that restructuring. And we've heard from inside of the agency widespread chaos at both the labs run by that agency as well as among the staff who are currently out in the field doing some of that work.
So according to a notice sent to their union, employees at the agency's Pittsburgh and Spokane offices will be most affected. What more have we learned about that?
Yeah, so just like all the other unions around HHS, those unions did get notices that told them, here are the areas within NIOSH that will be affected as a result of those cuts. Notably, on that list, they said that all of the employees in these different areas would be affected as a result of that cuts, including the director of NIOSH himself. We're told that he was put on administrative leave and is set to be let go, along with senior leaders all around the Department of Health and Human Services.
Alex, we know major changes are happening at the CDC. Most of the administration for strategic preparedness and response is merging into the CDC. Tell us more about those plans.
Yeah, that's right. So, as part of the restructuring that Secretary of Health Robert F. Kennedy Jr. has ordered, ASPR, which is the Administration for Strategic Preparedness and Response, is merging into the CDC. A lot of people probably haven't heard of ASPR, but they've probably heard of what they do. They do things like fund vaccine research into things like COVID-19 vaccines, as well as the vaccines that were used for the Mpox response a couple years ago. They also run the Strategic National Stockpile, and we're learning today that actually the layoffs at HHS affected the Strategic National Stockpile among the thousands of workers that were laid off at the department. That's part of this merger that they're hoping to finish within the next 10 days, if not sooner.
Alex Tin, thank you.
Thank you.